Welcome back. As men age, their bodies produce less testosterone. So what kind of issues can that decline cause, and what treatment options are out there?
Well, is it male menopause? As part of Wellness Wednesday with Avexia's Health Solutions and Inspire Medical Wellness, Sylvia Castaneda wanted to learn more, so here's what she learned.
Back with us is Dr. Jason Burchard, owner of Inspire Medical Wellness in Mount Juliet. I am so happy that you are here with us today to talk about a hot topic, men and hormones. So let's start with the basics, doctor. What are some of the most common signs that you see that men's hormones are, let's say, out of balance? Are we talking male menopause?
Well, that's a great way to say it, Sylvia, and it's a great question. I mean, the more common symptoms that a guy's going to experience, and we've kind of talked about it a little bit before, but it's worth revisiting, is they just start to feel like a shell of their former self, so to speak. So many guys, again, will come in and say, you know, I knew there was something wrong when I just started finding that I was losing motivation for even the things they enjoy in life. You know, their hobbies, you know, when we start to lose motivation for things that we're passionate about, we know something's not right. It reminds me of, we had a male patient one time that described it very beautifully when he said, you know, I love my wife, obviously I love my kids, but I knew that there was something wrong when I started coming home from work. I'd pull in the driveway and I really dreaded going inside. I knew that, again, that I couldn't be the father and the husband that I really wanted to be. Those symptoms, again, show up in things like obviously fatigue, chronic fatigue, brain fog. They're starting to notice, again, some weight gain that no matter how much diet and exercise they can't really get rid of. Those are typically the symptoms you'll start to experience well before the symptoms in the bedroom start to show up.
So then talk to us, doctor, about when do men start experiencing these hormonal shifts, and when should they get tested? So
there's so many variables to really that answer because of so many known endocrine disruptors today, meaning there's so many things within our environment, different toxins, the way our foods are processed today. There's so many different things that really will cause the testosterone deficiency to show up at a much earlier age than what we once experienced. So really, guys in their 30s can start to experience, again, the shift in testosterone, as well as really, again, the symptoms that can go along with that.
So men sometimes do not want to ask for help. There seems to be a stigma around that. So how do you go about getting men to talk about this and get tested?
Well, you know, I'm reminded of, we've all heard these phrases of, you know, oh, I would die for my family, right? And I usually challenge and encourage guys, would you live for them? You know, our number one really asset is our health. And when we start to lose that, we really lose the ability to effectively, you know, provide and protect for our family. So, I just really encourage guys to, you know, get your levels checked. If you're starting to feel those signs of, man, I just don't feel like myself anymore. I just don't feel like, again, that I can be the husband, the father that I really want to be. Get your levels checked. It's that simple for us to be able to determine, again, is there a conversation that we can have to navigate through this?
So talk about that. If someone is watching the loved one of the person or a man himself, how do you get them to take that first step? What would you say to them right now?
Well, I would tell them, you know, the first step really is again to get evaluated. You know, partner with somebody like, you know, ourselves at Inspire, or, you know, another facility that has partnered with Avexia's Health Solutions that really understands and knows hormones, knows how to safely, effectively navigate through optimizing your hormones. There's so many different modalities in doing this. We'll talk more about the importance of utilizing bioidentical hormones when you're optimizing your hormones and not using synthetic hormones, because those are completely different in nature.
Well, I would love to have you back to talk about that, but thank you so much for sharing all this great information with us to help men basically take control of their health.
Yeah, absolutely. Glad to do it.
I'm going to send it back to you.
All right, thank you so much. To learn more about hormone decline and hormone replacement therapy and its benefits, or to make an appointment, visit inspiremedicalsolutions.com, or you can visit avexius.com and then click Find a Provider.